Thank you, Mr. Chair. Thank you to the witnesses for what I believe is excellent testimony and balanced and gives us guidance on how to work together in a very bipartisan way, or nonpartisan way, a way that protects research globally to help people. I'm going to build on the discussion we're just having that we continually have heard over this hearing, but in other places, the importance of enhanced biosafety and biosecurity and how what they are to the future of pandemic preparedness. Now, I do want to say to my colleague, it has never been where the original COVID came from. It has not been established that it leaked from the Wuhan laboratory. I think everybody's got their own theories, but I don't want the facts that aren't true to be on the record either. But it is very clear that international labs are not meeting the kind of standards that they should be meeting. And as our witness said, that there is a scientific report out in March that recommends that international standards be the same as our standards. But it is a fact that bears repeating. We will not be prepared to face the next pandemic if we don't start doing the work now to fortify our biodefense with meaningful biosafety and biosecurity reforms. And to do so effectively, we must take lessons learned approach to pandemic preparedness and prevention. So I'd like to urge my colleagues on all sides that we must meet the urgency of this moment in the policy issues we are attacking. I'll give you an example of something we should be doing. Attempts to reauthorize critical legislation such as the Pandemic and All Hazard Preparedness Act, other words known as PAPA, currently is falling short of applying the lessons we've learned from the COVID-19 pandemic to improve national health security and biodefense capabilities. On top of that, we're letting the legislation expire at the end of September. And I wish Republicans, unfortunately, no, I don't mean that. That didn't come out right. Republicans have control right now, so we got to work together. I didn't mean that, Ronnie, to come out that way. But we're not making the investments needed to actually advance biosafety and biosecurity, two causes that we talked about today, and I know that my colleagues care about. In fact, the current Republican PAPA proposal would reduce funding for state and local public health emergency preparedness grants down to pre-pandemic levels. That's a $50 million cut from current appropriation levels, which would ultimately hamstring the ability of state, local, and territorial public health departments to respond to public health threats, including biological, chemical, nuclear, and radiological events. So, Dr. Yasef, let me ask you this. What role do state and local public health responses to public health threats, like the ones I just mentioned, play in biosafety and biosecurity at a national level?
Thank you. If we're really going to have an effective layered defense against pandemic risks to the American public and to the global population, we need to both have stronger biosafety and biosecurity to prevent those events from happening in the first place, but we also have to have effective capabilities to detect and respond quickly. And in addition to federal capabilities, state and local public health capabilities are critical, and we do have to resource them at the level that's necessary so they can perform their role. The COVID pandemic showed that we were woefully underprepared and unprepared to respond, and I'm hoping that we can, as you say, learn the lesson from that and build the capacity that we need, because when the next pandemic inevitably arises, we need to be ready.
I'm going to submit questions for the record to you, but yes or no. Would you say we're prepared for the next one?
No.
Thank you. Dr. Parker, what policies should Congress consider to fortify our biodefense capabilities from the local all the way to the federal level?
I think the more that we can emphasize the need to provide the right tools to our local and state colleagues, whether that's public health, emergency management, the private sector, NGOs, all disasters, including pandemics, hit multifocal areas around the country at different times and different severities. So the more that we can do to encourage and have our policies emphasize the support that will support our state and local. Just as an example, PAPA, and I'm really glad you brought up PAPA reauthorization. That's, in my view, that is essential. And you might see in my testimony of last June, for that hearing last June, I did talk about the need for supporting the tools that we're going to be, that ASPR needs are really the tools that our state and local community needs. The tools you may be thinking about for CDC are really the tools that need to be at state and local communities, whether that's public health or emergency management. So just that philosophy on supporting the local and state authorities and citizens is really, would be very helpful as we think about policies emanating from Washington, D.C.
Thank you. I have more questions to the record. I'm assuming you would say we are not prepared now, too.
We are not prepared.
And I really do want to work with my Republican colleagues because I think this is something we really can agree on. And if we came out of this committee with just that, it would really be good for our country. Thank you. Yield back, Mr. Chair.
Chair now recognizes Dr.